All right, hey guys, Dr. Sean here. I get asked this question a lot. I get asked about, Doc, what do you treat? What is it that you're actually doing with patients day in, day out? What conditions are walking through your door? What do you see? So I thought we'd do this little fun video here just to kind of give you a representation of what that actually is. Oftentimes people come to you and say, hey, I've got colitis, I've got Crohn's, I've got headaches, I've got, history of some chronic degenerative disease. Do you handle that? The answer is always yes. It's always yes. Our focus is about restoring normal to the body, bringing the body back around to a state of perfect health. And that means it doesn't matter what's going on with that body. A motto we used to always say, if you're breathing and not bleeding, we can probably help you. And that's kind of how it works. So when you're looking at this, you think, well, what does chronic mean versus acute? Acute conditions tend to be 6 weeks or less. That's kind of the general rule of thumb. If something has lasted longer than 6 weeks and you're not seeing a progression in it, getting better, and that's really the key to this, then hey, the body's really struggling with this and it needs help. Now the question is, where does that help come from? As you've all heard me talk before, I believe that stress is the cause of all disease. I tease that men are the cause of all stress. We talk about those mechanical things that get in there, the accidents, the traumas, the slips and the falls. Those things have to be addressed. And just because you missed a stair and fell and you hurt that knee, if you're 6 weeks out and it's not getting better, the body says, look, whatever's going on, you're now adapting. And you want to help the body not adapt improperly. You want to restore normal. The other aspect of the M.E.N triangle that I use is the E side, that energetic, emotional side. This is really hard, I think, initially for people to get their mind around, that thoughts become things. And that's just how it works. So what you think realistically is what this body has to do. A good example, take blood pressure. Blood pressure is a physical function of the body. But if you get angry, boy, it goes up in a hurry. Take a vacation. Sometimes we go on vacations, we have a great time. What happens to those bowels when you're out and about? They tend to slow down or speed up, or they get all squirrely. And you look at other things of that nature. Get worried and see what happens to that stomach, right? So these thoughts, the body will physically adapt to because it has no other way to do it. So you got to make sure you're always looking at that piece of the puzzle as well. Finally, the N in the M.E.N is the nutritional chemical side. When my grandfather practiced, he always called it the side of poisons. Is there some poison that's gotten into the body? All viruses, bacteria, funguses, parasites are poisons to the body, as is a poor diet. Or maybe something environmentally that you're breathing in, smoking, or drinking. Those are all toxins and poisons to that system, and they all cause the system to react. The key to the whole thing when you're looking at this M.E.N concept is that the body's, look, I've got one way to respond. I'm going to go into fight or flight. And when it does that, it contracts muscles and gets really tight. And the longer it stays in that tight, contracted state, all of a sudden the body's it exhausts. Once it exhausts, that's when chronic starts to show its head into your world. All of a sudden now you're saying, oh my gosh, I'm exhausted, the body and the tissues can't respond, and I start noticing my functions start becoming out of balance. So the question becomes, what are the functions of the body? Well, digestion's a function. Elimination is the opposite end of that same function. How about your glands and hormones? Maybe your nerves and your emotions, your sleeplessness. Maybe the musculoskeletal system, aches and pains, or even your circulation, your blood pressure, things of that nature. Those are the main functions of the body. So if you have a disruption in your functions, that means, gosh, doc, I've got symptoms. I'm taking medications, I'm doing therapies, but I still have symptoms. Then we know your body's out of balance and it needs some help. And that's exactly